Welcome to The Explainer. Today, we're going to tackle something that, let's be honest, millions of us deal with: joint pain. We're going to break down what's causing it, how doctors get to the bottom of it, and, most importantly, what you can do to feel better.
You know the feeling, right? That dull ache that just hangs around, or maybe that sharp twinge that catches you by surprise. It's so easy to just ignore it and hope it goes away. But what is your body actually trying to tell you? Let's dig in and find out what's really happening behind the pain.
So first things first, let's talk about just how big of a deal this is. It's way more than a minor annoyance for a lot of people, and understanding why it's so common is really the first step to getting a handle on it.
And here's the thing. This is not just an old age problem, not at all. It can hit anyone at any time. Yeah, for some people it's just a little bit of discomfort, but for others it can be totally debilitating and mess with their daily lives. So before we can even think about solutions, we have to get our heads around all the different things that could be causing it. Okay, let's get to the heart of it. Why do our joints hurt? The answer? Well, it's a bit more complicated than you might think. We're going to start with the two big ones you've probably heard of. First up is osteoarthritis, or OA. People often call this wear and tear arthritis, and honestly, that's a pretty great description. Imagine the cartilage in your joints is like the tread on your car's tires. Over time, with more and more miles, it just wears thin. That's basically osteoarthritis. The pain usually gets worse the more you do, and it tends to feel better when you rest. Now, rheumatoid arthritis, or RA, is a whole different beast. This has nothing to do with mechanical wear. This is an autoimmune issue. What that means is your own body's defense system gets its wires crossed and starts attacking the healthy linings of your joints. This causes a ton of painful inflammation, basically from the inside out. And this slide really puts it all in perspective. Look at the difference. On one side, you've got osteoarthritis, which is all about that physical wear and tear. On the other, you have rheumatoid arthritis, which is your body attacking itself. This is why the symptoms are so different, right? OA pain flares up with activity. But for RA, a classic sign is feeling super stiff in the morning, along with this deep, nagging fatigue.
But wait, it's not always arthritis. There are a few other common culprits we need to talk about. You've got things like gout. This is where sharp little crystals made of uric acid decide to have a party in your joint, causing sudden, really intense pain. Ouch. Then you have things like bursitis and tendinitis, which are all about inflammation in the tissues around the joint, like the little cushions or the tendons.
And believe it or not, the list keeps going. It could be a straightforward injury, a serious infection that's gotten to the joint, or even a symptom of a much bigger systemic disease like lupus. This is exactly why you don't want to play doctor on the internet. The number of possibilities is just huge.
So, with all these potential causes floating around, how on earth does a doctor solve the puzzle? Well, it's kind of like detective work. They use clues from all over to build a really clear picture of what's going on inside your body.
And a huge piece of that puzzle comes from your blood. Doctors can look for specific fingerprints, you could say. For instance, things like rheumatoid factor and anti-CCP are antibodies that act like a smoking gun for rheumatoid arthritis. Other tests, like ESR and CRP, are more general. They don't name the disease, but they tell the doctor how much inflammation is happening in your body. And of course, checking uric acid levels is a dead giveaway for gout. And the detective work often goes even deeper than that. A doctor might want to look at your genetic markers for certain conditions, or even check how your liver and kidneys are doing. Why? To make sure that whatever treatment plan they come up with is going to be safe and effective specifically for you. It's a really thorough process. All right, so you've got a diagnosis. Now for the good part. What can you actually do about it? This is where you get to take back control, with strategies to manage pain and protect your joints for the long haul. Think of this as your personal toolkit. Lifestyle changes are huge. Staying at a healthy weight takes an incredible amount of pressure off your knees and hips. Physical therapy can build strength where you need it. Even simple things like a brace can give you support. And yeah, some supplements might help, but, and this is a big but, you absolutely have to talk to your doctor before you start taking anything new. Now, for those with really severe damage, where the pain is just constant, it's important to know there are some powerful options on the table. Things like minimally invasive surgery or even a total joint replacement can be life-changing, offering incredible relief and getting you moving again. But you know what's even better than managing pain? Preventing it in the first place. And it's not about some crazy, complicated routine. It's the small, everyday stuff. Staying active, setting up your desk properly, lifting with your legs and not your back,
even just drinking enough water. These little habits can make a massive difference over a lifetime.
Okay, if there is one thing, just one thing you remember from all of this, please let it be this. Do not try to diagnose yourself. We just saw how many different things can cause that same ache or pain. Guessing what's wrong and treating it yourself is a terrible strategy. It might not work, and you could even make things worse. Always, always talk to a professional.
Seriously, just think about it. From walking around, to typing on a keyboard, to giving someone a hug. Your joints make it all possible. They do so much for you. We've seen how complex they are, but also how much power we have to take care of them. The real question is, what are you going to do to support them back? Thanks for watching The Explainer.